My name is Corey Gada,
Dan Marty.
and this is our slideshow on physician-assisted suicide.
The pros of physician-assisted suicide is patients will be put out of their misery. They can die with some dignity. They won't be putting their families through great amounts of pain seeing their loved ones suffer. It will cut down on costs to keep the machines going and bills piling up if treatment seems imminent. If the doctor doesn't do it, they may try to do it themselves, which could be more devastating. Doctors can focus on patients who actually want to live and have a chance.
So physician-assisted suicide is when a physician helps in a patient's death by providing the necessary means or information to enable the patient to perform the life-ending act. And the physician may provide sleeping pills and also give the lethal dosage while knowing that the patient may commit suicide. And this occurs when there's no cure found for the patient, and the patient and the physician both know that death is coming soon. And there can be positives and negatives that come along with physician-assisted suicide. So physician-assisted suicide is legal in 4 states in the United States, and that is Oregon, Vermont, Washington, and California. And in these certain states, they must follow certain laws. These laws include the patient must be at least 18 years old, the patient must be a resident of this specific state, and they must be within 6 months of their expected death. And there are no laws regarding physician-assisted suicide in Nevada, North Carolina, Utah, and Wyoming.
So the cons of assisted suicide: that doctors violate the oath in which they swore to do all they could be seen as murder to many people, even morally wrong because suicide's a sin, cause an uprising in religious communities, such as how abortion does. Doctors could be given a lot of power, which in some hands could pose a threat. Life's sacred by taking it away so easily, it shows people no longer fight to the end. Is assisted suicide ethically right or not? Quoted by the American Medical Association, physician-assisted suicide is fundamentally incompatible with the physician's role as healer, would be difficult or impossible to control, and would pose serious societal risks. Instead of participating in assisted suicide, physicians must aggressively respond to the needs of patients at the end of life. So ethically, it would go against the doctor's oath. Doctors need to do all they can for their patients to treat them, and if not treat them, just try to make them more comfortable in the end. Arguments for assisted suicide: people should have the individual right to end their life if they are in great physical pain, which would result in death. Argument that euthanasia is already being practiced, but people calling it that, it's somewhat of a form of it. They do not resuscitate call, or if a patient doesn't want to be brought back to life when the doctor easily could. It's a palliative sedative which puts one to sleep to make them more comfortable. It's known to speed up when a person is to die. This in question can be a form of euthanasia. So the underlying argument is, if we're already doing it disguised in different forms, why not just allow assisted suicide?
Who would choose physician-assisted suicide? So those in pain, or those that fear that they may be in pain in the near future. Those that feel that they're a burden to the family, whether it's because they're just so sick or because the cost of their health care is too much for the family. And those that have no desire to keep living, whether it's because they're living a bad quality life, they don't want to just sit in a hospital bed and not really be able to function. Some negatives to physician-assisted suicide: a lot of people believe that doctors are supposed to make their patients healthier, not help them to die, and it endangers the weak and the vulnerable and may cause family tension if some of the family thinks that this family member should be put out of their misery, but other parts of the family think that suicide is not a right decision. It also betrays human dignity, and some physicians may give the lethal injection without permission from the patient.
Different cases of assisted suicide. One is a case of Brittany Maynard, which happened recently within the last year. Developed brain cancer in her late 20s. After treatment, her tumor was removed, but it had come back, giving her only a short time to live. She talked it out, and she wanted to end it on her own terms with her dignity, not in a hospital bed where she could develop potentially morphine-resistant pain and suffer personality changes in verbal, cognitive, and motor loss of virtually any kind. She moved to Oregon because assisted suicide was legal there, where she could die peacefully before the tumor took over who she was. Another case is Dr. Kevorkian, nicknamed Dr. Death, who had assisted in over 130 deaths. Even though it wasn't legal, he felt if the patient wanted it, he should be able to care for every patient's need, including death. He was charged with second-degree murder in prison for 8 years. Opinions on assisted suicide. As of 2015, 56% of people feel that assisted suicide is morally accepted, and with each year the numbers climbing. People today are beginning to recognize that people have the right to die if they're suffering. Some feel the number is climbing because the amount of people religiously involved has declined over the last number of years. 7 out of 10 Americans believe that euthanasia is acceptable, showing that as a whole, people's opinion on the matter is that assisted suicide should be allowed and legal in all states. Talking it over with just family and friends, all agree that if their loved ones wanted to die and there are no treatment options left, they would allow it. Some, though, said that if from a religious standpoint it's wrong and death just has to take its course, people shouldn't play God. So to sum it up, is physician-assisted suicide ethically right? From a medical standpoint, no, it violates the doctor's oath, but from any other standpoint, I guess it just depends on the person.
And that's it for our PowerPoint. Hope you enjoyed it.